Congestive heart failure, understanding pathophysiology, treatment, and patient education. Welcome to my presentation on congestive heart failure, or CHF. CHF is a complex syndrome defined by the American College of Cardiology and the American Heart Association. It arises from structural or functional problems in the heart's ability to fill or pump blood effectively. Ischemic heart disease is the leading cause of CHF, impacting approximately 26 million people worldwide. This condition not only leads to significant morbidity and mortality, but also contributes to substantial healthcare costs. Effective management of CHF focuses on relieving congestion and stabilizing hemodynamics. Key strategies include patient education, optimal medication use, and preventing exacerbations. CHF is classified based on left ventricular ejection fraction, or LVEF, as well as the ACC-AHA stages. These classifications range from at-risk patients to those experiencing severe symptoms. Thank you for your attention as we go deeper into the complexities of congestive heart failure. In response to increased workload or injury, the heart undergoes structural changes known as myocardial remodeling. This includes hypertrophy, or the thickening of the heart muscle, and dilation of the chambers. Depending on the underlying pathology, remodeling can be either eccentric or concentric. Cardiac myocytes, or heart muscle cells, can exhibit hypertrophy, undergo apoptosis, which is programmed cell death, and suffer from impaired contractility. These changes lead to decreased cardiac output and reduced efficiency of the heart. To compensate for these issues, the body activates mechanisms like the renin-angiostensin-aldosterone system, RAAS, and the sympathetic nervous system. Initially, these symptoms aim to maintain hemodynamic stability. However, chronic activation leads to fluid retention, vasoconstriction, and increased myocardial stress. Fluid overload. Fluid overload causes symptoms due to the fluid buildup in the lungs, known as pulmonary congestion, and in the peripheral tissues or edema. This occurs because of increased venous pressure and reduced cardiac output. Interstitial fibrosis. Chronic heart failure results in increased fibrosis, disrupting the heart structure, impairing electrical conduction, and increasing the risk of arrhythmias. Increased ventricular stiffness. In case of heart failure with preserved ejection fraction, the left ventricle becomes stiffer, which impairs diastolic filling and raises filling pressure. Symptoms of heart failure can vary greatly. Some common signs include shortness of breath, especially during activities like climbing stairs, and persistent fatigue or weakness even at rest. Coughing and swelling, particularly in the ankles, lower legs, or abdomen due to fluid buildup, are also frequent symptoms. Difficulty sleeping when lying flat, nausea, and loss of appetites are common. Swelling in the veins of the neck and a frequent need to urinate can also occur. Initially, symptoms may be mild or absent, but they tend to worsen as the condition progresses. Heart failure can lead to various serious complications due to fluid buildup and reduced blood flow to organs. Firstly, breathing problems can occur because of the fluid accumulation in and around the lungs, often referred to as congestive heart failure. Next, there's the risk of organ damage. Both the kidney and the liver can be affected, with potential outcomes like cirrhosis due to insufficient blood flow. Malnutrition is another concern. Fluid buildup can make eating uncomfortable, and inadequate blood flow to the stomach can impair digestion. Heart failure can also cause heart conditions such as irregular heartbeats and sudden cardiac arrest. Lastly, pulmonary hypertension can develop, which is an increase in pressure in the pulmonary arteries. These issues underscore the importance of managing heart failure effectively to prevent such severe complications. To diagnose congestive heart failure, your healthcare provider will review your medical history, including any other health conditions, family history of the disease, or sudden death, tobacco and alcohol use, chemotherapy or radiation history, and current medications. A physical exam will check for signs of heart failure and related diseases. Heart failure progresses through 4 stages. Stage A, high risk due to factors like hypertension, diabetes, coronary artery disease, alcohol use disorder, and family history. Stage B, left ventricular dysfunction or abnormalities without symptoms. Stage C, diagnosed heart failure with current or past symptoms. And Stage D, advanced symptoms not improving with treatment known as heart failure with reduced ejection fraction. Diagnostic tests include blood tests, cardiocatheterization, chest X-ray, echocardiogram, heart MRI, cardiac CT, EKG, MUGA scan, stress test, and genetic testing. These tests identify the presence, stage, and cause of heart failure to guide effective treatment. To manage mild to moderate heart failure, several drugs are commonly used. First, ACE inhibitors help by increasing vasodilation and decreasing the workload on the heart. Next, diuretics promote the removal of excess water, salts, metabolic products from the body. Glycosides, such as digoxin, increase the force of the heart's contraction, which is particularly useful in some cases of heart failure. Beta blockers are also used to decrease the excessive activity of the sympathetic nervous system, which is characteristic of mild to moderate heart failure. When dealing with severe heart failure, more aggressive treatments may be necessary. Loop diuretics, like furosemide, are commonly used to treat edema caused by congestive heart failure. Vasodilators are another option to help manage severe conditions. Perinatal inotropic agents such as dobutamine can be used in end-stage heart failure to improve symptoms and quality of life. These require advanced planning and management, but offer a non-surgical option for patients as they transition through care stages. When managing heart failure, several medications play a crucial role. ACE inhibitors like lisinopril help reduce blood pressure and decrease the workload on the heart by promoting vasodilation. However, they may cause side effects such as cough, elevated potassium levels, low blood pressure, and dizziness. These drugs are not suitable for individuals with a history of angioedema, pregnancy, or severe renal impairment. Beta blockers, such as carvedilol, decrease heart rate and reduce sympathetic nervous system activity, improving heart function. Common side effects include fatigue, dizziness, bradycardia, and hypotension. They should be avoided in patients with asthma, severe bradycardia, heart block, or decompensated heart failure. Diuretics, like furosemide, promote elimination of excess fluid and sodium, which helps reduce edema, blood pressure. Side effects can include electrolyte imbalances, dehydration, and dizziness. They are contraindicated in cases of anuria, severe electrolyte depletion, or hypersensitivity to sulfonamides. Aldosterone antagonists such as spironolactone block effects of aldosterone, promoting diuresis and reducing heart remodeling. Potential side effects include hyperkalemia, gynecomastia, dizziness, gastrointestinal disturbances. These are contraindicated in several renal impairment, hyperkalemia, and or Addison's disease. Lastly, digoxin increases the force of the heart contraction and slows the heart rate. Side effects might include nausea, vomiting, dizziness, and visual disturbances like yellow or green halos. It is contraindicated in patients with ventricular fibrillation, hypersensitivity, or severe renal impairment. In some cases, devices are also used to manage heart failure. An implantable cardioverter defibrillator, or ICD, is indicated for primary prevention of sudden cardiac death in patients with heart failure who have left ventricular ejection fraction of 35% or less. Finally, the selection of drugs and combinations depends on the initial clinical state and how the patient responds to initial therapy. This personalized approach helps achieve the best outcome for each patient. Managing coexisting conditions is crucial when dealing with congestive heart failure. Key conditions to manage include diabetes, kidney disease, anemia, high blood pressure, thyroid disease, asthma, and chronic lung disease. It is important to note that some of these conditions may exhibit signs and symptoms similar to congestive heart failure. If you experience new or worsening non-urgent symptoms, be sure to inform your healthcare provider. Treatment for congestive heart failure can also lead to complications such as hypotension, kidney failure, and infections from frequent hospital visits involving central IVs. Monitoring and addressing these complications promptly is essential for effective management. Understanding the pathophysiology of coexisting conditions is important in managing congestive heart failure effectively. High blood pressure leads to heart muscle thickening or hypertrophy, which reduces the heart's efficiency. Coronary artery disease narrows arteries, limiting blood flow to the heart muscle. This can cause ischemia and myocardial infarction, further weakening the heart. Arrhythmias, or irregular heart rhythms, can disrupt the heart's pumping efficiency, decreasing cardiac output and worsening heart failure symptoms. Diabetes results in high blood pressure sugar levels, which can lead to diabetic cardiomyopathy. This condition weakens and stiffens the heart muscle, impairing its ability to pump effectively. Thyroid dysfunction can also complicate heart failure management. Hyperthyroidism increases heart rate, while hypothyroidism decreases cardiac contractility. Substance abuse, including alcohol and drugs, can directly damage heart muscle cells and lead to arrhythmias, further compromising heart function. Finally, infections can cause inflammation of the heart muscle, known as myocarditis, leading to reduced heart function and exacerbating congestive heart failure. Managing these coexisting conditions is essential to improving outcomes for patients with congestive heart failure. Living with congestive heart failure significantly impacts daily life. Participants describe the discomfort from fluid buildup, noting that my ankles hurt due to this condition. Many initially failed to recognize their symptoms as heart failure, leading to delayed action and disruption to their lives. Managing these diverse symptoms is challenging. For instance, one patient mentioned, "Everything seemed to be sticking," reflecting the complexity of recognizing heart failure symptoms. Educating patients to identify these early signs is crucial for effective self-management. Coexisting conditions add another layer of difficulty. Differentiating heart failure symptoms from other illnesses and managing complex medication regimens can be overwhelming. As one participant shared, they changed all those. The role of family and friends is vital. Strong support networks help individuals accept their diagnosis and manage their condition better. One participant noted, "They cut my grass for me and that sort of thing," illustrating how support can make a significant difference. Overall, living with congestive heart failure requires a comprehensive approach, including symptom recognition, managing coexisting conditions, and having a robust support system. Being diagnosed with heart failure can be both frightening and stressful. However, there are some important steps you can take to manage your condition effectively. First, it's crucial to take your medications as instructed. Do not skip doses, even if you start feeling better. If you're having trouble affording your medications, talk to your doctor or nurse for assistance. Next, always inform your doctor if you experience any side effects or other issues with your medications. Your doctor may be able to switch you to another medicine or adjust your dose to avoid bothersome side effects. Monitoring your symptoms is also vital. Pay close attention to how you feel and look for any signs that your heart failure might be worsening. If you notice any changes, contact your doctor immediately. Lastly, know when to seek emergency help. In the United States and Canada, dial 911 if you experience severe shortness of breath or any urgent symptoms. By following these steps, you can better manage your heart failure and maintain a higher quality of life. To effectively manage heart failure, it is important to follow a Mediterranean diet or DASH diet while limiting salt intake to reduce congestive symptoms. Fluid restrictions may also be necessary, as advised by your healthcare provider. Regular exercise and physical activity are important, and participants in cardiac rehabilitation programs can further improve your functional capacity and quality of life. Additionally, it is essential to quit smoking and avoid excessive alcohol consumption, especially if your heart failure is alcohol-induced. By adhering to these simplified guidelines, you can better manage your heart failure and enhance your overall health and quality of life. In summary, effectively managing heart failure involves understanding the condition, including recognizing its signs, symptoms, and stages, and being aware of how coexisting conditions can impact it. Adopting a heart-healthy lifestyle, exercising regularly, taking medications as prescribed, and seeking support from family and friends are crucial steps in treatment. Proactive care is essential. Educate yourself, monitor your condition, and adhere to treatment plans to improve your quality of life and outcomes. Lastly, be prepared for emergencies by knowing the warning signs and having a plan for immediate medical attention. By following these guidelines, you can better manage heart failure and enhance your overall health and well-being.